All right, well, we are just over a month away from the new school year, so summer is coming to an end eventually. We're talking to our friends at Rochester Regional Health about some health-related back-to-school topics. And this morning, we're talking about food allergies. We're joined by Dr. Peter Capucilli, who is an allergist and immunologist. Doctor, good morning.
Good morning. Thanks for having me.
Yeah, we're so happy to have you here because I think this is a topic that a lot of parents have to be concerned about. And, first I want to ask, how common are food allergies with kids?
So food allergies are becoming increasingly more common. Certainly in the past 3 decades or so, we've seen an increase in the number of kids who have food allergies. If we're looking at reports, we'd estimate about 6% of kids, maybe a little bit higher, 6 to 8% likely have some food allergies. And then there's a lot of concern for food allergy as well. And even some kids who may test positive for food allergies. And those are some details that we like to work out in clinic to figure out who actually, is allergic to a food and who needs to avoid them.
What are some of the most common food allergies? My top of mind, I think peanut butter, obviously peanuts, but what are some other common food allergies?
Certainly peanut is up there among the top 3. For the youngest kids, infants, milk and egg are also the 2 most common food allergens that we see the most.
Yeah, when both my daughters had dairy intolerance, which was so much fun to learn when they're a few weeks old. You recognize the symptoms. And in babies, they're crying, they're red, they have issues with digestion. What are some of the signs of food allergies in older kids? Obviously, if a child goes into anaphylactic shock, they're allergic, but I'm sure there are much lesser signs of similar allergies.
Yeah, and those signs and symptoms do change over time with age, as we're finding out through newer data. But the classic symptoms that you would see are number 1, symptoms that come on pretty immediately after ingesting the food. So there's no really delayed food allergy when we're talking about anaphylaxis, but it really is that the symptoms start while you're eating or within usually minutes after eating the food. And most food reactions, but not all reactions, but most tend to involve skin symptoms like hives, so very itchy raised rashes that tend to spread over the skin pretty quickly, and they're splotchy and very itchy. You can get swelling of the face, swelling of the eyes, and also gastrointestinal symptoms like vomiting or nausea should alert you to that.
Yeah, and then is it just if it's ingested, or can some food allergies become a problem if you're even touching the food?
Sometimes, kids or adults can be sensitive to the food when it touches the skin. Usually to have a systemic reaction, though, you have to eat the food.
Okay, that's good to know. And then what should parents do, if their kid does have allergies and they're sending their kids to school? I remember my mom would make my lunch and we'd start swapping snacks and whatever. You end up eating other people's food. Probably not the best idea right now during coronavirus, obviously, but kids are kids. So what should parents do to prepare their kids when they're headed back to school if they do have a food allergy?
So I think for the parents whose children do have food allergy, there are a couple things to make sure you're basically on top of as the school year is starting. One is just knowing that your epinephrine auto-injectors, the rescue, epinephrine injectors are up to date or refilled, and that you have one, and that there's one, in school with the school nurse. The schools do a great job of making sure that's in place every year. It's also really important that your allergist provides you with an anaphylaxis plan. So that's a document that basically outlines what to do in the event of a potential exposure to a food. So that in those moments of, usually some heightened emotion, you don't need to think as much, right? It's more, I'm seeing these symptoms and this is what I do, X, Y, Z. And that should be spelled out and both the child should have a copy and the, school nurse for sure should have a copy as well. And I think for parents whose kids don't have food allergy, I think awareness is important.
Yeah.
And education. Certainly it helps for the kids in the class who are dealing with this to have classmates who are supportive and understanding that this is an important thing to be thinking about and to be supporting their friends.
Yeah, coming up with a plan and awareness, 2 great tips. Dr. Capucilli, thank you so much for joining us this morning. And I think a lot of people starting to get ready in that back to school mindset, and this is something we should all consider. So we appreciate it.
Thanks for having me.